Welcome back to News at Prime, the Friday edition. I'm Timbekile Mkhototo, just to update you on the latest data from the National Institute for Communicable Diseases, the NICD, in a report out a short time ago confirming another 2,828 new cases of COVID-19 have been identified in the country. 12 new deaths as per the report that's out tonight. When you look at the provincial breakdown, Limpopo has about 88. Gauteng is still the hotspot. It's recorded the lion's share of the new infections at about 2,173. I mentioned Limpopo because our next guest tonight is the province's health MEC, Phophi Ramathuba, who's joining us live now. MEC, a very good evening to you. So the number of new COVID-19 infections in your province still low compared to Gauteng, but you are, just like many other parts of the country, quite worried about where we're likely headed at this point.
Evening, Jamaican, and evening to all your viewers. We are indeed very worried. If you look at the population for Gauteng and the population for Limpopo, so the 88 might look like it's a small number, but the reality is that our population is far lower than Gauteng. So when we register 88 cases, you must know for us it's also a disaster, especially if you look in the past 2-3 weeks. There were days where we go by without anyone testing positive for all the specimens that we would have contested for COVID-19. So now from 0 cases in 24 hours to 10, and then jump to 27 2 days ago. Yesterday we jumped from 27 to 75. Today we've jumped to 88. So that is, it's clear that our honeymoon is soon to be over.
And what do you understand to be driving the slow uptick in Limpopo?
The slow uptake of
the slow rise in the number of cases.
Okay. The reality of the matter is people have started to be complacent. And people are no longer wearing their mask. That is a fact. When we started to register 0 cases, there were people who were even telling me that this virus is gone. And we have reminded them that even last year, around this time, the virus fooled us and we thought it's gone. But December festive season, when we started to enjoy our weddings and our birthday parties and Christmas lunches, we saw the spike. So right now, for me, the reason it's that we're not too sure if it could be as a result of this new variant, which is driving the 4th wave in other parts of the country, especially Gauteng. It could be possibility at that. But for me, where we are sitting, mostly the unvaccinated people who are coming back home, they are also contributing to that. Because the cluster outbreak also, which is one of the reasons around Exxaro mines, when we detected that outbreak, which is responsible for these numbers, it's also similarly to the unvaccinated people. Mm-hmm. What is very painful, Tembekile, is that those 57 cases that we detected within a space of 4 days, and the following day, another 23. So they are responsible for the 88. When we analyze, it's mainly those who refuse to be vaccinated. And the mine management, together with us, we've been working closely. We even went there and have the massive campaign of vaccinating. But there were other workers who were refusing to be vaccinated. And of this number of people who have tested positive, majority are those who are not vaccinated. And those who are vaccinated, whom we are able to pick up through the tracing, they are asymptomatic, which confirm the fact that the vaccine can protect your life.
Mm-hmm. But the one challenge that you and the other MECs and national government are going to face this time round with the 4th wave, as far as trying to get people to comply with the non-pharmaceutical interventions, to wear masks, not gather in large crowds, is that, as we've been seeing since yesterday, people are saying, why should they do that when political parties were able to campaign, gather people in large numbers for the November elections, and that now that that has come and gone, the expectation is now back to citizens behaving?
The reality, which we need to be honest, is that we were not facing the spike at the time. We had no cases. And if you look at even on the election day, and we must commend the IEC, they were very strict in terms of following the rules. The gatherings were allowed at that time because we were on the level 1 lockdown. Our numbers, like I'm saying, the infection rate in my province, there were days that we go by without people testing positive. And in our rallies, we were emphasizing the message that please try to wear your mask. So you did not have a variant that was driving the wave at that time. And many people were scared to speak after the elections. We are going to see the numbers spiking. And the numbers did not spike. The fact of the matter is, currently what we see is that more people are getting infected now. And we have got to respond to that. So to say we are not going to wear them because you were campaigning, it's not going to ask. At the end of the day, until such time as South Africans, we can learn to appreciate that my health, first and foremost, is my responsibility. Government will come to support me, but I must take responsibilities for my health. And you know, most of the political parties during the campaign, they were bringing us to their rallies to go and vaccinate their members, which was very good initiative. And that also has assisted for those who were campaigning, who were in rallies, who were vaccinated. It assisted them a lot. But most of the people who are saying all this, there are people who did not attend any rally, but there are people who might be partying as we speak. There are people who are not vaccinated, and we don't know exactly what people want. Yeah?
To be fair,
we're saying as a province.
To be fair, and I'm not saying this is specific to Limpopo, but I sat in this chair for a number of rally broadcasts on this channel, and there wasn't always compliance with distancing. There wasn't always compliance with the wearing of masks at all times. And the point I'm making is about the fact that you're now going to have to go up against an issue, even if it wasn't a reality reflected in actual infections, but there is a perception issue that you're now going to have to deal with, where people say, when it was convenient for politicians to have us gather, they were okay with that, but now they're not.
I can reassure you that if during the elections we had a variant and we saw the numbers spiking, we were going to ask the IEC if it means to postpone, they would have postponed. The reality is, during the elections period, we had no variant that is responsible for driving the wave. I agree with you that yes, we were also raising in certain rallies where people were not complying, and there were men who were raising some of this concern. It's a fact. But what I'm trying to say to you is that at that time, even last year at that time, our numbers were very low. We did not have a wave during that time. But the fact of the matter is, currently, we are experiencing a wave. And what is worse, we are told that there's a new variant, which we are not even sure how virulent this virus going to be. We are not yet even sure how transmissible will it be, worse than the Delta and the other previous variant. We're not yet sure. So for us is to say to the people, currently we have a situation and we need to work together. I'm seeing now on social media, many people have planned weddings come this December. People have planned their birthday parties, their retirement parties. This is our opinion as a health. We can't force you, but it will be good if you can also assist us by, when you are inviting your guests, to also require them to be vaccinated. And if you invite us to your wedding and say, we want you to come and vaccinate people, we are available to do that. We are also saying to you, if we comply and have few guests in our weddings, and we have few people in our birthday parties, it might assist us. We have a situation currently that the numbers are not going down, they're continuously going up. And what is it that we want to do as a nation? To remind people that we were campaigning and we were many. The fact of the matter, we did not have a variant, we did not have a wave during elections, and people did not die during elections due to COVID-19. But we don't know what is going to happen now that we have detected this variant and we are seeing numbers are going up.
I'd like to speak to you then about the issue of vaccines. You're saying you're available in Limpopo, for example, to set up a vaccination site, as it were, a pop-up vaccination site at a wedding, for example. But there are still some people who say that in rural parts of Limpopo, it's not as accessible as it should be, that they're traveling long distances. Generally, what is the availability of vaccine sites, and what is the general distance from a person's home, place of work, and the site?
Let me indicate to you to say, in Limpopo we have got a motto that says rural health matters, and our rural people are always our priorities. That is why almost all our clinics currently, they are offering the vaccines. And your clinics, it's supposed to be 7 kilometers away from you at most. That is the first thing. We'll make sure that our clinics now, they got accredited, they are now vaccinating. Secondly, we still have got outreach wherein we have partnered with the House of Traditional Leaders. All our Mahoshi and our Indunas, they even invite us to their tribal authority where we are vaccinating. You might have seen last week I was at Limpopo village, far flying outside Guyana. We've gone there, we've vaccinated people. So our outreach programs are focusing on those rural areas. If you remember, we even in the beginning says to all the farming areas, we partner with all our farmers, Agri-SA in the province. We have gone to the farm workers, we've vaccinated them in their place of work. People must be honest with you. The vaccine sites in rural areas in Limpopo are available. Anyone who can call me and say, I've got 50 people, they want to be vaccinated in my village tomorrow, I will make sure that vaccinators are deployed there and they go and vaccinate. They must not come up with stories. Our people have got vaccine hesitancy, especially the younger generation. As a province, we did well when we come to the above 60 because that generation is not on social media. They don't go around reading fake news. They believe in their own community leaders. Now we are dealing with your generation. They are too clever. They read fake news and they scared each other, and there is vaccine hesitance. So we are calling upon young people out there to say, you have become a danger to your parents. Festive seasons are coming, schools are closing, universities are closing. You'll be coming home next week. When you come back home, we don't know which variant are you bringing to the old lady that we have vaccinated. We're not sure what impact will the vaccine have on the new variant that you are going to bring. So this is our appeal to say, all young people out there who knows that they reside with elderly people, please go and vaccinate, protect our people. And if Gauteng spike the way it is spiking now, I become the most MEC who gets worried. If you go on N1 now, even on the toll gate, the cars are still packed. People are coming back home. They work in Gauteng, they stay in the province. So you can't separate what's happening in Gauteng from what happened in Limpopo. So that's why it's my appeal.
Before we run out of time, what then is being done for people who aren't within a 7-kilometer distance of the nearest clinic? You said if someone says they've got 50 people that need vaccination, you'll be there tomorrow. What happens when it's less than 50 and you're further than 7 kilometers? If
you are further less or more than 7 kilometers.
If you said
because if I'm saying the furthest clinic to the population must be 7 kilometers.
Okay.
If your clinic, if you stay far from the clinic, remember on a daily basis we have got mobile clinics that go and service such people in the far flank. So already there are mobile clinics where we draw every day. There's an outreach. There are mobile clinics that are going to those far flank areas to vaccinate. So I'm just saying to you to say, even if you have got 20 people who want to be vaccinated, we're going to locate the nearest clinic to you and send the vaccinators to where you are to be vaccinated. So all what we're saying is that we can't expect you when you are 2 in a village and say, come and vaccinate us when you are 2. That one we will not do. But if we have 20 or a sizable number, like we do with our outreach to the clinics, we are available. You know, even we're discussing with Minds, even right now, Anglo is going to give us some vehicles that we are also going to be using them to move around those areas where even our mobile vehicles, because of the nature of the roads in the province, can't reach that area. So they've come on board. They will be assisting us with that. So for me, I'm saying anyone who wants to be vaccinated, they must talk to their local Indian or their chief. Their chief will organize with us and will come and vaccinate them.
Health MEC in Limpopo, Phophi Ramathuba. Good to speak to you. Thank you, ma'am.
Thank you.